Obesity is a complex medical condition, but it's often treated as a character flaw. Weight bias is a significant problem that many healthcare professionals implicitly or explicitly express.
Wait, Josh, what's weight bias?
Great question. Weight biases include assumptions that people living with overweight or obesity are lazy, incompetent, lacking willpower and self-discipline, and not motivated to improve their health.
So you mean people who are overweight aren't just lazy?
That is simply untrue. There's increasing evidence that obesity is a complex condition associated with biological, socioeconomic, and psychological risk factors. These factors predispose many people to obesity through no merit of their own. Despite this evidence, again, many healthcare professionals continue to view obesity as solely the consequences of an individual's poor lifestyle choices.
You! Did you know that weight bias goes far beyond the number on the scale? It affects real people and real health outcomes. Individuals who fall victim to weight bias may experience severe consequences such as delayed or missed diagnoses, incorrect assumptions like assuming lifestyle behaviors without asking. This can lead to patients avoiding routine care due to negative experiences in the past. In 2021, a patient who was experiencing severe gallbladder pain was told to just lose weight, delaying further treatment. That patient was me. In 2021, I woke up with gallstones and had to be taken to the emergency room. Previously, doctors, nurses, everyone, all of the above, had just told me to lose weight. But I knew something else was wrong. So why was this happening? This happens because of patient stereotypes about size. This happens because there's a lack of training for providers as obesity as a chronic multifactorial disease. Many providers rely on the BMI, which is not actually a predictor of health behaviors or metabolic status. But the good news is weight bias is fixable, and it starts with small changes.
Bias is real, but the good thing is we can change how we deliver care. Every provider has the ability to make small but important changes to help accommodate and make safer care. First, listen without assumptions.
Let patients describe their symptoms fully and listen without judgment and wait to bring up weight.
Research shows that when a patient with higher weight receives judgment from their provider, they are less likely to trust them.
Wait, isn't care all about trust?
Second, use neutral language. When consulting with a patient, refer them as a patient with higher weight and not an obese person.
Avoid using stigmatizing terms. Treat the person, not just their body size.
Third, treat symptoms like you would with any other patient. If a patient comes in regardless of their weight and they're complaining about chest pain or fatigue, order diagnostics and treat their symptoms. Changing your approach by listening, using neutral language, and treating symptoms seriously isn't just about respect, it means better patient outcomes.
Providers, stop focusing on weight and start focusing on what matters, treating patients with obesity.